So as I was saying, the ACSM labelled CrossFit an extreme conditioning program, saying that it was violating established exercise principles. We were putting participants at risk of overtraining, being over-competitive. The novice CrossFit participant was particularly at risk because they were asked to do unskilled movement they hadn't learned at speed and under fatigue, with maybe too much load and inadequate rest. So the US military also had concerns. There was a Consortium for Health and Military Performance, combined with the ACSM, by Berger and et al. In 2013. That's highlighting the musculoskeletal risk for the novice participant. That's really where the risk was, that they were saying. Injury is highly costly to the military, both the US and the British military, and some of it goes against the military doctrine for physical training. So if you've ever done military doctrine, trying to rewrite that is like trying to get blood out of stone. It's going to be very challenging, so they're unlikely to want to do that. But what they need to do clearly is improve their exercise prescription and their exercise implementation, so that extreme conditioning programs have all the risk reduced and we just control the controllables. So training injury rates. So scientifically, it's not very sound that we just take a load of case studies. This is a very low level of evidence to indicate injury patterns in sport. We're talking about CrossFit today, and it's common practice, which is where the problems come from. So it's problematical to compare injury statistics across sports because of so many factors: the number of people involved, the estimated exposure time, the variable injury definitions. It's very challenging. So sports injury data is best expressed in injuries per 1,000 hours of participation. So we've got to be careful with our definition of injury. So, for instance, it could be major trauma here. You can see this is unfortunately a failed lift. Okay, it could be minor trauma. We could be talking about blisters in the hands, or we could be talking about an overuse injury that flares up. So, what our definition of injury is important. Is it something minor that you can just train around, that's going to keep you out of doing particular exercises for a couple of days? Is it going to be potentially surgery and some significant rehab, or is it going to be a trip to the physiotherapist and scaling back and doing some low-level exercises while we address this overuse injury? What is our definition of injury? That's key. So there are some tragedies that have happened, like Kevin Ogar, who unfortunately ended up being a wheelchair user after a traumatic incident. And we've got some other studies by Friedman about a traumatic tear of a lat dorsi, and Zumwalt about an acute Achilles tendon rupture. Okay, and these things have clearly happened, but they're case studies. If we also go to some real interesting study here, or on some cervical internal carotid artery dissection, which is a significant injury. Now this journal's reporting 3 cases of that. Although it hasn't got any direct causality, it can't prove that. These cases are very rare. I've never seen it in 7 years, and I think these clearly happened, but they're rare. The other thing that's rare is exertional rhabdomyolysis. Okay, there's a paper published here, says a rising concern. CrossFit had already identified that if you do too much, this is a potential risk, and had already started educating people about that, because before, people really wouldn't have associated exertional rhabdo with it, had CrossFit not admitted that it might happen. I've never seen it in 7 years. I've heard about it. It clearly exists, but 2 cases for me is not a rising concern. So the ACSM compared itself to CrossFit, and concluded that CrossFit leads to very hard perceived rate of exertion. I'm not sure we really needed a paper to prove that. And that there was some severe post-exercise physical dysfunction. And that's the key, really. There was an excessive amount of muscle soreness for this particular group, and the 5 workouts of the day that they did were the benchmarks workout, things like Fran, Murph, Fight Gone Bad, Helen, and Filthy 50. These are quite tough workouts. They're not really for the beginner, and they stress the importance of this beginner course that CrossFitters must do. You can't just walk straight in off the street. You've got to do some lessons. Even if you're experienced in some sorts of training, you've got to learn the lifts, and you've got to be progressive in your adaptation. They are highlighting that there's a fine line that exists between delayed onset muscle soreness of significance and exertional rhabdo. So moving on. So this was the first paper by Hack et al. 2013. It's a British study. They're an orthopedic team in Wales, and they were the first ones. They basically did a questionnaire, so 132 participants, and the injury rate looks like it's quite high. 73% were saying they had some sort of injury, but really, when we break that down, that's only 3.1 per 1,000 hours of training, and the common injuries were the shoulder and the lower back. You can see here, shoulder and the spine were the most significant of those. Then we got the other study by Wiesenthal et al. In 2014. This is an American study, and it's really doing a lot. Double the number, 386, and these are all athlete level participants, and that's the key there, athlete level. And that's saying that the guys were more likely to sustain an injury. The overall incidence, injury rate was much less, but if we work out in terms of exposure time, it's only 2.4 injuries per 1,000 hours of CrossFit, which is not a huge amount. You can see, for the back and the shoulder there. So they're the 2 cornerstone studies, effectively. Then we got a more recent study here, and it's coming up with a similar injury incidence of 2.3. Per 1,000 hours of CrossFit. And again, the repeated pattern of the shoulder, the knee, and the lower back being injuries associated with this. And they're saying that increased height or body mass is related to injury, and also being a competitor is related to injury because of the increased amount of exposure time. So if we just have a look at some of these studies, you can see this is the Wiesenthal study, highlighting 12 lower back injuries and 21 shoulder injuries. Again, the Hack study, shoulder and spine, and then my study that I've snuck in there, shoulder. For me, lower back is way down, but shoulder was definitely the most prevalent in my study. So systematic review by the Duke University by Jepson et al. Again, they're pointing to the shoulder and the lower back, then the knee. So we've got this repeated pattern of these are the 3 body areas that are going to get injured. We're not going into the diagnosis of what was happening at the shoulder, what was happening at the spine, what was happening at the knee. Unfortunately, that's beyond the scope of this. We're just saying that these body areas are associated. So Summit et al. In 2016 saw that the shoulder was potentially the most vulnerable area once we're doing CrossFit, and we had 187 participants over a 6-month period, and the injury rate was less than the 2 studies, the Hack and Wiesenthal studies, with 1.94 shoulder injuries per 1,000 hours of CrossFit. The mechanism of injury was attributed to improper form, or a previous injury. And we know from loads of other studies that the biggest predictor of injury is previous injury. So if we deep down look at it in this as well, now the mechanism of injury looks like, it's more from getting the bar above your head. So overhead pressing, snatch, any sort of Olympic lifting, push press, that sort of thing, that is more significant than kipping pull-ups. Look at kipping pull-ups, only 5 from that. Okay, so if you were to combine two movements like Fran, where you're doing thrusters and pull-ups together, okay, this may predispose people to injury because we're doing the two movements, kipping pull-ups, okay, and thrusters that may make the shoulder more vulnerable. So Chichula et al., this is a US study from 2015, and they're just highlighting that if you have a previous injury, you're more likely to sustain another injury through CrossFit. Obviously, that's documented in other activities, but not in CrossFit, so that's a good study. So a lot of the studies have been done in the US and North America. That's where the main studies, but nothing in South America until Spray et al. 2016. They were doing this study in Brazil. So they recommend there's probably about 40,000 CrossFit participants in Brazil. So they sent out 620. They had 622 questionnaires completed. And 176 of those reported injuries. They haven't reported their injury per 1,000 hours, so it's difficult to compare. But they're saying that if you've been doing CrossFit less than 6 months, actually you're less vulnerable, and if you've been doing it more than 2 years, you're more vulnerable. Okay, so for here, the practice time was the significant factor for their data. Okay, so if you've been doing CrossFit greater than 6 months, you are actually at more risk of injury, which is contrary to what some of the others were saying with regard to the beginner being more vulnerable. They also talked about delayed onset muscle soreness being misinterpreted as injury. So what we're doing is we're just summarizing these studies as well. Okay, so Chichula, Hack, Montalvo, Weissenthal, and the Summit study. Okay, so we can have a look at those numbers. Weissenthal obviously has the biggest amount of participants in their study. Looking at the shoulder, okay, shoulder is definitely number one for the upper limb. Okay, obviously with the Summit study, that's all they did. And then you can see that the spine is next, okay, followed by the knee. Also, the wrist should get a mention here as well. Okay, so injury comparison between studies, if we summarize that. So Hack has the greatest injury incidence of 3.1 injuries per 1,000 hours. Weissenthal, okay, 2.4 injuries per 1,000 hours. Remember that this study was on athlete level participants. Okay, Spray saying that 31% injury rate. Chichula saying you're more likely to get injured, you've got previous injury. Summit, 1.94 per 1,000 hours of training, shoulders only. Okay, Moran is another study that we haven't got time to cover here. 2.1, Montalvo, okay, 2.3. And just remember these shoulder, low back and knee injuries, although they're common, they're pretty acute and they're pretty mild. Okay, so when we're talking about shoulder pain, we're not talking about a shoulder dislocation. Okay, we're talking about a little bit of rotator cuff related shoulder pain. So gender specific association. Are blokes more likely to get injured than ladies? And the answer might be yes. Okay, certainly Weissenthal thinks this because the girls are more likely to seek help from the coach. Guys are more likely to just do their own thing. So the key here is that good coaching prevents injury. The guys also tend to have a performance-based approach to their goals and an emphasis on going as prescribed, going RX. So CrossFit workouts are set at a certain weight, and if you're using that weight for the workout, you're considered that you're going RX. So there are scaling options within this. And this is where some of the injuries might occur. People lifting more than they're capable of. Okay, so which divides CrossFit really into 4 different types of participant. So your beginner, because CrossFit's quite complicated, it's going to take you up to a year before you're really competent at this. That's if you're going 2 or 3 times a week. That's only 150 hours in your first year. That's not a huge amount of time. If we're talking about 10,000 hours to become a master. So the recreational CrossFitter, they've been doing it over a year. They've adapted to most of the tasks. Okay, and then normally they go into competition, and if they're a competitive CrossFit athlete, they could be new to competition in the first couple of years. They've stepped it up, they're lifting more, they're working at intensity, and then obviously you've got the elite.